Welcome to the Inside Out Midlife Revolution, a clinical dossier on copper peptides, hormone truths, and true vitality. I am Dr. Brenda Smith, and I am excited to share this video with you. Since retiring from day-to-day practice, the questions about midlife health have multiplied. Women are often confused by the noise around skincare and hormone therapies. True midlife wellness requires a big-picture view, addressing the system, not just the surface. My dual approach to aging covers both the outside and the inside for true vitality. External repair focuses on skin health, featuring copper peptides. Internal clearance focuses on BHRT, liver health, balancing hormones, and eliminating toxins. This revolution bridges aesthetic desires with functional internal health. Let's explore copper peptides, specifically GHK-Cu, the regenerative signal peptide. These are complex molecules that bind to a copper ion, acting as bioactive carriers that initiate profound cellular repair. They accelerate healing, fade pigmentation and scarring, and deliver structural remodeling without harsh retinoids. Copper peptides are the ultimate skin builders, working in 4 key ways. They act as foremen, macrophages, to promote repair, as scaffolding, fibroblasts, to stimulate collagen, as relaxers, neuromodulators, to soften wrinkles, and as shields, antioxidants, to neutralize free radicals. When navigating GHK-Cu, use topical serums, 1% to 3%, and always perform a patch test first. Be warned, do not mix with strong acids or benzoyl peroxide, as this degrades the peptide. Also, use caution if your skin barrier is compromised. Patience is key for safe tissue rebuilding. Turning to the inside, my hormone journey evolved from prescribing the gold standard in the 90s to pivoting to bioidentical hormone replacement therapy, or BHRT, when patients reported side effects. I learned the patient is always the best lab, leading me to a personalized transdermal approach. The lock and key principle explains why molecular shape matters. Bioidentical hormones fit cellular receptors exactly, triggering beneficial functions. Foreign hormones, like synthetic progestins, do not fit perfectly, causing partial or unintended responses and side effects. Oral pills go through the first pass effect, overloading the liver and leading to unwanted metabolites and inflammation. The transdermal advantage of BHRT creams bypasses this, allowing direct absorption through the skin to the tissue receptors for the desired effect. The monitoring matrix shows how to measure hormones. Blood tests are useful for natural hormones, but can show false lows for BHRT creams. Saliva tests, which measure free hormones at the tissue level, are the gold standard for safety and accuracy on BHRT. The missing link is metabolism and clearance. Once hormones have acted, the body must metabolize and eliminate them. If the liver is sluggish, unhealthy levels of hormone metabolites build up. We need to proactively help the liver process these compounds with hormone helpers. My hormone helpers provide targeted liver support for safe hormone metabolism. These include Xymogen Xenoprodex, MedCaps DPO, and Liver Protect. They support the detoxification phases and provide daily crucial support for this hardworking organ. Inside-out vitality is the synthesis of external repair, rebuilding skin architecture with GHK-Cu copper peptides, and internal clearance, balancing systemic hormones safely with transdermal BHRT and liver support. True midlife vitality is a supported, optimized system, never just a cream or a pill. Your revolution starts here. Navigate your health slowly and intentionally. Ask your provider hard questions and demand therapies that respect your unique physiology. Remember to patch test your copper peptides, ask about saliva testing, and support your liver daily. Health is wealth.